Well, more than $1 billion is being pledged in the fight for better access to vaccines in Africa. French President Emmanuel Macron and several African leaders have been meeting in Paris to launch the African Vaccine Manufacturing Accelerator. The funding will be used to speed up vaccine rollout and to help build a better manufacturing base on the continent. Inequalities during the COVID-19 pandemic meant that African nations had to wait a huge time for vaccines and testing equipment. Well, let's take a closer look at some of the vaccine-preventable diseases in Africa. The World Health Organization says more than 30 million children under the age of 5 suffer from preventable diseases every year. It's estimated the deaths of African children represent more than half of all global vaccine-preventable deaths. The most common preventable diseases include malaria, cholera, pneumonia, measles and rubella. Well, let's bring in Professor Helen Rees. She's the Executive Director of Wits, the largest research institute at the University of Witwatersrand in Johannesburg. She's also chair of the WHO's African Regional Immunization Technical Advisory Group. She joins us now from Johannesburg. Professor Rees, we saw it painfully clearly during the COVID pandemic that the level of inequality when it comes to vaccine access. I understand this push has been in the works now since 2021. Why has this all taken so long?
Well, it's a very good question, and there have been many articles written about the lack of equity for access to vaccines. So we certainly saw it in COVID. By the time we got really good access to vaccines here, many countries had already experienced COVID outbreaks. Many people had immunity from natural infection. And so the impact of the vaccines was much less here, simply because we got them too late. But we're also seeing it now with Mpox. Mpox has been endemic in Central and West Africa for many, many years. When we had the multi-country outbreak about 2 years ago, with many tens of thousands of infections in high-income countries, immediately vaccines were made available. Prior to that, for the African region, vaccines were not available. But what this has done, and COVID really started this, is it started a dialogue about access to vaccines and medicines and diagnostics, everything you need to control outbreaks and to stop vaccine-preventable diseases. And that dialogue is very much centered around equity and how do we increase access for the African region.
Professor, I've been wondering about the obstacles here and why the huge delay. Has this been primarily about intellectual property issues, or has this been about bottom lines?
It's a combination of all of those things. And then there's sort of old-fashioned things like vaccine shortages and not enough manufacturers. So certainly for COVID, there were intellectual property issues, tech transfer wasn't easily available. And the big issue here for the African region is that we have very, very limited manufacturing of vaccines in this region. So we import about 99% of the vaccines required for this region. And this region is the region that probably second to no one needs vaccines, particularly for children. We only manufacture about 1%. So manufacturing is certainly one of the issues, and intellectual property and tech transfer, all of that is one of the issues. Stockpiling from high-income countries, we saw it with COVID, we've seen it with Mpox, but also just the shortage of vaccines for diseases that don't affect really high-income countries. So something like cholera that you mentioned, where we have significant outbreaks at the moment, there aren't a lot of manufacturers. So there is a shortage of vaccine. Similarly, we've seen shortages of vaccines for things like yellow fever. So shortage is another thing. And that's the manufacturing end. But just getting access, even if there are available vaccines, getting access and for countries being able to afford to purchase them is another big challenge.
I see the African Union is now aiming to have something like 60% of vaccines administered on the continent, made on the continent by 2040. I mean, that's not long away. Is that realistic given the constraints that you're talking about?
Well, it's a target, and it's a very ambitious target. Manufacturing vaccines isn't easy. Some sorts of technologies are easier to manufacture, but if you're starting manufacturing in many countries from a blank sheet of paper, you're really starting afresh. That will take some time. But I think we've also learnt with COVID that we can accelerate this. Prior to this, I mean, we just hadn't thought enough about it in this region and really pushed for it. So I think if there is investment, if there is tech transfer, and some companies have certainly committed to this, if we are seeing that there are serious networks being set up for manufacturing, which we've seen with the mRNA vaccine, which, if you remember, was one of the major vaccines for COVID. We are seeing all of this. We're seeing backing by the African Union and the African CDC and the World Health Organization, and country leadership is also asking for it. It's ambitious. We might not get there, but I think we will certainly establish an element of manufacturing that we haven't seen before.
Professor, you mentioned investment there. You're someone who's leading investment efforts at the Gavi Vaccine Alliance. What is your priority when it comes to directing that investment? So when you're getting funds and donated funds, particularly from the West, in this case, for instance, where are they going, and are specific diseases being prioritized?
Well, Gavi, I mean, I chaired a committee that looked at sort of 5 years into the future and saying what are going to be the new vaccines. Gavi supports particularly the introduction of new vaccines, which otherwise just were not getting to the low middle income countries when Gavi started out. So the way that Gavi looks at this is to do very, very, very careful assessments of, what is the vaccine? How effective is it? What is the burden of disease in the low middle income countries, which is their target for support? What is the burden of disease? How many deaths can we stop? What will the development impact be? What is the impact around things like gender, which we don't often think about? And so all of that is weighed up with very complex modeling. And then decisions are made on really what is the best investment. Some of these vaccines that we will see will have a very specific regional focus, things like the meningitis vaccine, for example. It's in the meningitis belt in the African region. Others will be, just can be used in many countries and in different parts of the world. But that is how Gavi prioritizes.
Well, certainly everything we've seen today has been a very overdue and welcome change. Professor Helen Rees, the chair of the WHO's African Regional Immunization Technical Advisory Group, joining us today from Johannesburg. Thank you for joining us on the Al Jazeera NewsHour.
Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.